One of the biggest things that I've done to get my name out there is I always have business cards on hand, and I go to a lot of young professional organization events, meetings. I sit on a board within Charlotte. They're a local young professional. It's an arts and social organization called the Young Affiliates of the Mint Art Museum. I also get involved with local societies, whether it's, I went to Michigan State for my undergraduate studies and Ohio State for my optometric studies. They both have local alumni groups in the region where I'm at, so I've reached out to a lot of people that way. I've engaged in a lot of chamber events in the regions where I practice, not to mention just trying to get to know people that I live around. I feel like if you get out there and really do a grassroots effort to start building your name within the community, patients will come in, they'll trust you, and they'll refer their friends and colleagues. Managing staff from a doctor's perspective is obviously extremely challenging. Personally, I try to look at my staff as my eye care team. I think staff is an infection you get. I think your eye care team, if you come in with the energy and excitement that every patient that comes through that door, we're going to deliver the best possible care, it's the greatest approach you can take. So I treat every single member of our eye care teams on an equal playing field, an equal level, and I think they greatly appreciate that, and they respect me in return. One of the greatest technological advances that I've seen help grow our practice, and it's been around since I've been an undergrad, but I take advantage of the friendships that I have on Facebook and just asking them to check out our practice's page and our website and keep track of any updates that we have, and I actually help with some of the content that goes on our websites, as well as I answer a lot of the questions that patients may have in regards to clinical care, whether it comes in regards to products or when it comes to insurance coverage through the website. And those technological advances have been extremely beneficial for our practice, as well as me as helping me grow as a clinician. One of the other really interesting things that I got to experience coming out of optometry school technologically is I'd never worked with a digital phoropter, and I'd always worked with a manual phoropter, and one of the practices I work at has digital phoropters, and I'm able to quickly show patients what their manifest is versus their old prescription versus any other prescriptions that they have with a click of a button, and it really gives patients that wow factor. Wow, doctor, was there a change? Let me show you. It's really awesome.